So this is the only muscle that we treat when cervical rotation is limited. It's the serratus posterior superior, and basically the serratus goes through here, in through there as well, and where it can get jammed up is all through this area. You can get it caught on the levator, you can get it caught on the rhomboid, the fascia, everywhere in there. Now the key here is this one's a little harder for the client to go through that motion. The first step is always you're gonna bring that arm over and have them lock that in place. Now this one is a little bit different. So the motion for the client is gonna be twofold. You're gonna start them slightly rotated away, and then they're going to turn like that, as comfortable as they can go. They're not gonna force it, and then once that happens, you want them to drop their other ear down to the floor. So it's in two separate motions, so you really wanna slow that down. So you get this first part in here, and then you get the rest of that. That's gonna help you pick up the rest of that tendinous area where that serratus comes. So the setup for this is really key. So you're gonna have them slightly rotated, and what I'm going to do is I'm gonna find that spinous process over here of C7, and I'm gonna go in just like this. And you're just gonna let it come to you. So it's nice and relaxed, very similar to other setups that we see with the levator, and you're gonna come in at that 45-degree angle. You're gonna go in just like that, and you're gonna sink in with your body. And then this one, you're actually going to pull some tension with your lat and drop that in. That's going to lock in that area. So I want you to kind of see, come a little closer. So without the thumb in there, you're gonna get that depth in like that, and then your tension is like that. So now that it's set up, I'm gonna go in just like that. I'm gonna back that thumb up. You're gonna get that depth with that body lean, and your tension is going to be dropping in, and the client is going to turn, 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 turn. You're gonna feel that come over, and then they're gonna drop that opposite ear. Now, a lot of times, this can be more of a difficult motion for the client as well, and this is one where I will go in and actually do the motion. It's not ideal, but if you're gonna use your thumb in like this, you'll be here, and I'm gonna help them with that motion. So I'll sink in with my body, and I'll pull tension like that, and then I will rotate them just like that as it comes, and then once it gets there, I'll drop their head down, just like that. So sometimes the client can't do the motion and they mess that up, and when that happens, you can't get an effective treatment. So essentially what I will do is I'll do the motion for them. So we'll sink in just like that here, and then I'll get the tension here, and then I will do the motion, moving their head and then dropping it in. It's not ideal, but if they can't relax or they can't do the motion, because a lot of times they'll turn their head and they'll drop it too quick, you want to be in control of this, because this area is very dysfunctional for that cervical rotation. If you can clean it up correctly, it's going to make a big difference.